Hello everyone and welcome to Case Study 3. My name is Leolani Writtenhouse. I am 25 years old and I've been working within the ABA field for over a year and a half. I'm currently working within a local clinic in the state of Indiana as an RBT, and I provide services to learners ages 2 to 10 years of age. An overview of this final case study is that within this presentation, I'll be going over a brief description of the client that I've chosen to assess for this case study. I will be discussing the client's behaviors, functions, assessments, and treatment integrity. I will also be discussing the rationale as to why these assessments are being utilized and how the results are relevant to the BCBA task list. As stated prior, we're going over the client summary. The client's name is Client B, as to protect confidentiality, and they are age 2 and diagnosed with autism spectrum disorder, or ASD. Again, this client is an energetic and active 2-year-old boy who prefers cars from his favorite movie, foam tiles, books as his main form of reinforcement. This client is presented as an early learner. They display skill deficits that are focused on social skills, communication skills, and fine motor skills. Our behaviors for concern as thus far is mouthing, tantrums, SIB or self-interest behavior, aggression, throwing objects, and elopement. As stated in the next few slides, continue to explain behaviors to learning and behaviors of concern, starting with aggression and tantrums. Then throwing objects, as well as proactive antecedents and setting events. We should always be remembering that the therapist should be interacting with the client at all times, that the therapist should be playcasting most interactions with the client. The therapist should be promoting or prompting vocal commands located within the intervention plan, as well as being within arm's reach of client at all times, and the setting events of this is denied access to preferred activity or items or termination of said preferred activity or item. We do this with functional communication training and with manding for escape, pointing to preferred items, and waiting for preferred items with an alternative item. Our staff training protocol, or our training methods that we utilize to help teach it to how to implement these is we utilize the behavior skills training, which the steps for the behavioral skills training, or BST, is step 1. We provide instructions that include the reasonings or the rationale and the operational definition of the skill being targeted. We then provide specific, clear, and concise descriptions of said skill or skills. Moving forward from that, we demonstrate or model this skill or procedure being used. 4, we require practice of role-playing or demonstrating the skill. We then provide or give feedback after observing the initial role-playing or practicing of skill, and then we move forward to repeat the feedback and practice until the skill has been generalized and mastered. Again, within step 1 and step 2 of the BST, or the training, we provide instructions that include the rationale and the operational definition, which this means that the BCBA creates a clinical rationale, as well as they create and utilize teaching instructions with prompting strategies for the functional communication training implementation. Moving to step 2 is that we provide a description of said skill. We continue to model and prompt functional communication after problem behaviors occur. So, for instance, client B engages in a tantrum. We wait 5 seconds before prompting functional communication with their PECs or their AAC device. We wait for client B to repeat on device and for it to be successful, or after we deem it successful, we remove the demand that was being placed and we provide reinforcement. That is said for if the prompting or description of the skill is unsuccessful. Then client B engages in a tantrum. We wait 5 seconds before prompting with an AAC device. We wait for the client to repeat, and if unsuccessful, we prompt again, we remove the demand and redirect utilizing differential reinforcement. Step 3 is we demonstrate or model the skill, and during direct supervision or observing the RBT, we make sure that we are practicing and we are demonstrating the implementation steps for those that are handling these procedures, which then we require the staff members to and observe them while they are demonstrating these skills. After they correctly or clearly demonstrate or not demonstrate the skill, we provide positive or negative feedback after the staff has clearly demonstrated or not demonstrated these skills. Furthermore, we continue repeating feedback and demonstration of the skills until these skills have been fully mastered. And we will issue staff to continue practicing and demonstrating these skills, and in turn, again, provide any feedback if applicable or necessary. So which leads us to how we are maintaining treatment, integrity, validity, and fidelity within our implementation of these procedures. And that is to ensure validity, that it is continuing to be respected and practiced, is that we ask staff to continue to practice treatment implementation, and we monitor to ensure the treatment infidelity. We would implement several strategies to make sure that the staff are correctly utilizing and implementing the behavior treatment plan as it was written. We also continue to supervise during direct observation with staff, and if it is being implemented incorrectly, we provide feedback to the member of staff to review the instructions under program or the plan and discuss with them the correct steps as they are written to ensure knowledge and competency of procedure. As to ensure no confusion, if there are any questions or concerns, there would be the time to remodel or demonstrate the procedure skill again to provide any additional training. We finally would issue the staff to ensure that data collection is being taken correctly and have them collect IOA to observe and ensure that the fidelity or the validity of the plan is being run entirely. After assessing and linked the overall results to the BCBA task list, I was able to add these additional terms and tasks to the PowerPoint. The new ones that we are going over during this PowerPoint was I-4, which is training personnel or personal staff to competently perform assessment and intervention procedures. I-5, using performance monitoring, feedback, and reinforcement systems. I-6, which is developing a functional assessment approach. Performance diagnostics to identify variables affecting personal performance, and I-7, which is determining what function-based strategies to improve personal performance. If there are any questions or concerns, feel free to leave any comments or concerns or reach me by email. Thank you for watching.